All right, this is Unit 6, Section 2, Time to be Born. After listening to this lesson, you should be able to identify and describe signs of labor, explain important events that occur during each of the 3 stages of labor, differentiate among the most common procedures used for complications of childbirth, and then compare and contrast a mother and baby stay in a hospital room with a stay in a birthing room. All right, birth occurs about 266 days after conception or 280 days from the mom's last menstrual cycle. During the last few weeks of pregnancy, especially for a first pregnancy, the mother experiences lightening or changes in the baby's position. When lightening occurs, the uterus settles downward and forward and the baby descends lower into the pelvis. In most cases, the baby's body rotates so the head is towards the birth canal. In about 5% of cases, however, the baby moves into a breech birth position in which the baby's feet, legs, or buttocks emerge first. When lightening happens, the mother can breathe easier because the baby is no longer pushed all up in her ribs. Okay? Leg cramps may result, however, and frequent urination is common due to the increased pressure of the baby on the mom's bladder. Because the mother's body is preparing for labor during lightening, she may have a few irregular contractions. A contraction, a vocab word, is the tightening or shortening of a muscle. Irregular contractions are known as false labor. These contractions are real, but true labor has not begun. Parents-to-be may go to the hospital only find contractions are false labor. Carefully timing the intervals of periods of time in between contractions can help parents know whether the mother is really in labor or not. Labor begins when a series of contractions in the uterine muscles move the baby out of the mother's body. These contractions are involuntary. The mother cannot make these contractions happen. Natural signals from the mother's body control when they start, how long they last, and the strength of the contractions. Contractions occur at regular intervals that allow the mother's muscles to relax. As labor progresses, contractions increase in how long they last and how strong they are. These intervals of relaxation between contractions decrease. Parents who are in doubt about the type of contractions should call the healthcare provider and go to their planned birthplace. Besides regular contractions, there are several other signs of labor. One sign the mother may feel is a burst of energy due to increased adrenaline. Another sign of labor is the loosening of the mucus plug in the cervix. The small amount of blood in the mucus is called the show, which means labor should start within 24 hours. Another sign of labor may occur when part of the amniotic sac breaks before labor begins. Often the sac will break after labor begins. If the mucus plug becomes dislodged or forcefully removed, or the amniotic sac breaks, the mother should notify her healthcare provider. As we mentioned on the previous slide, 5% of cases, the baby moves into a breech birth position. And there are 3 different types of breech. There's the frank breech, the full breech, and a footling breech. And we will talk about and show those in class. Okay. In medical terms, labor is divided into 3 stages. 1, dilation, or the opening of the cervix. 2, the delivery of the baby. And 3, delivery of the placenta. Sometimes we consider there to be a 4th stage, and that's the resting stage and the recovery stage. But medically, there's only 3 stages. Okay, stage 1, dilation of the cervix. In the early part of labor, contractions come every 15 to 20 minutes and last about 30 seconds. In the middle part of the first stage of labor, contractions may last 45 to 60 seconds and are about 2 to 4 minutes apart. The most difficult labor occurs in the later part of the stage, called the transition. Contractions last for 90 seconds, so about a minute and a half, and are so close apart that they often feel continuous. Contractions cause the uterus to narrow, which straightens the baby's body and presses the baby's head, or butt, if they're a breech, against the cervix. As the baby pushes against the cervix will flatten and then open up, which is dilating. If the amniotic sac has not broken, the doctor will break it when the cervix is fully dilated. And they just take like a needle and they jam it up there and break the sac. Full dilation of the cervix measures about 10 centimeters in width, which is 4 inches, which is the size of a small grapefruit. The first stage of labor ends when the cervix is completely open. The length of time for this stage varies a great deal, but the average length is 8 hours for a first pregnancy. Okay, so think about how long you're going to have contractions for if it lasts for 8 hours and how short the contractions are. Eesh. Thank your parents for what they've done for you. Okay, stage number 2, well, particularly your mom. Delivery of the baby. After the transition phase of the first stage of labor, the second stage of labor begins with the lessening of contractions for about an hour. This allows mother to rest before the very active delivery phase begins. During the delivery stage, the baby's head enters the birth canal and the mother's muscles push to move the baby down. The walls of the upper part of the birth canal are elastic. The arrangement of muscles in the lower part of the canal, however, causes resistance and pain. The doctor may have the mother use natural techniques like breathing to reduce pain. Sometimes a cut, called an episiotomy, is made to widen the birth canal and prevent tearing. Another practice is to lubricate the birth canal to ease the baby out. After delivery, the doctor stitches any incision that they make. The baby changes position during birth and faces downward as the widest part of the baby's head becomes visible, which we call crowning. Soon the face appears from forehead to chin. The doctor usually suctions fluid from the mouth and nose and checks that the umbilical cord is not wrapped around the baby's neck. The baby's head turns to the side as the shoulders rotate inside the pelvis. This position allows one shoulder and then the other shoulder to emerge. Finally, the baby's entire body comes out, often with the help of the doctor. The remaining fluid from the amniotic sac is expelled. Instruments are used to suction fluid from the baby's air passages, which helps the baby take his or her first breath. The second stage ends when the baby is free of the mother's body. The time of birth is noted. The second stage usually lasts between 2 and 3 hours, with the longer time required for the first-time mothers. The doctor, or sometimes the father, clips the umbilical cord before the third stage begins. The third stage is the delivery of the placenta. So in about 5 to 10 minutes and possibly up to 30 minutes after the baby is born, the mother has a few irregular contractions. These cause the placenta to completely detach from the uterus and to descend. The placenta and fetal membrane expelled following the birth of a baby are called the afterbirth. The drug Pitocin is often used to help the uterus contract, which stops the main flow of blood. Nurses also massage the lower abdomen to aid the contraction. As the third stage ends, mothers feel a little cold and tired. They also feel relief and joy. Okay, so some complications of childbirth include premature delivery. So baby may not be mature enough to survive. Baby is often not in the correct position for delivery. Premature rupture of membranes. Amniotic sac breaks, but labor doesn't happen. Infection is a danger with this. A baby who is mature will be delivered. With an immature baby, drugs are given to help prevent infection until it's delivered. A prolonged delivery, both mother and baby are at risk for other complications. Abnormal position for delivery, baby can be injured and the uterus may rupture. Sometimes the position may be corrected. If not, the baby may be surgically removed. Cephalopelvic disproportion, baby's head is too large to pass through the mom's pelvic bones. Baby is then surgically removed. Umbilical cord problems, so there can be compression, where a hollow cord is wrapped around the baby's body. Prolapsed, where the cord slips into the birth canal and is trapped between the baby and the canal. The umbilical cord supplies oxygen to the baby, and a baby who is deprived of oxygen can be born with cerebral palsy, visual problems, brain damage, or can even die. If the cord cannot be returned to the proper position, the baby is surgically removed. Asphyxia is where oxygen supply is cut off due to problems with the placenta or umbilical cord, which can cause brain damage or death. After birth, breathing problems may result if lungs have fluid or waste materials. Chest massage, drugs, and respirators can be used to stimulate breathing. Meconium aspiration, if the baby passes a stool before birth, the meconium in the amniotic fluid can be swallowed or breathed in, and the baby may be covered in meconium. Swallowing sterile meconium is not a problem. Aspirating it, though, causes the baby to have mild or severe breathing problems, which can last for years. Doctors attempt to suction meconium from the baby's nose and mouth before its first breath. And then postpartum bleeding, the uterus should contract and squeeze the blood vessels shut that supplied the uterus during pregnancy. Massage and hormones are given to help the uterus return to its original size. In rare cases, surgery may be needed to help close the blood vessels and stop the bleeding. Complications may occur in childbirth that can put both mother and baby at risk. When complications arise, special medical care involving the use of delivery aid techniques protects the health of mom and baby. Which technique is used depends on the nature of the problem. Each technique poses risks but has Important advantages. Before delivery, a woman's doctor explains to her any technique, risks, and advantages. The woman can then decide whether to have the procedure. The most common procedures used for complications of childbirth are drug-assisted deliveries, vaginal-assisted deliveries, and surgical removal of the baby. During drug-assisted deliveries, if complications occur, doctors administer a increased amount of drugs, such as anesthesia or sedation. Other drugs are used if an episiotomy is needed, and still other drugs are used for excessive bleeding during the third stage of labor. With vaginal-assisted deliveries, about 5% of all deliveries in the U.S. are vaginal-assisted. Doctors may offer the following types of assistance. Manual assistance, so they often use version or manually rotating the unborn baby into the correct position for delivery. If the baby's shoulder is caught after the head is free of the birth canal, manual assistance is one of several options to help free the shoulder. Operative vaginal delivery. The doctor may choose to use forceps, which is a curved instrument that fits around the sides of a baby's head. Forceps aid in easing the baby down the birth canal during a contraction. They can also be used safely with premature babies and can be used to aid version. Forceps may cause more trauma for the mother than the baby. The other option is vacuum extraction, in which suction is used to attach a cup-like device around the top of the baby's head. It allows the doctor to gently pull the baby down the birth canal. Vacuum extraction may cause more trauma for the baby than the mother. The option usually depends on the nature of the complication. And then cesarean births. Many delivery complications are handled through cesarean section. In the cesarean section, the mother's abdomen and uterus are surgically open and the baby is removed. The incisions are then closed as with any other surgery. Okay, with each C-section that you have, the risk of needing a hysterectomy, which is a surgical removal of the uterus, increases. More than one C-section also increases the risk factor for a miscarriage or stillbirth with your next pregnancy, or a uterine rupture during a vaginal birth after cesarean, which is VBAC. Okay, some reasons for cesarean would be the mother's pelvis is too small or not shaped for an easy birth. The baby or mother is at medical risk. The baby's head is large. Contractions are weak or absent. The baby is in an incorrect position for birth. The pregnancy is a multiple birth, although some multiple births are vaginal or vaginal-assisted deliveries. Or the doctor feels that previous uterine scars could rupture during labor. So although one cesarean birth does not mean that all later births have to be C-sections too. C-sections have the same risks as other major surgeries. Recovery after childbirth is longer with C-sections than it is for vaginal deliveries. Also, having more C-sections raise the risk factor for future complications. For parents who choose hospital births, both mother and baby can expect to remain in the hospital for 24 to 60 hours after delivery. The stay will be longer for complicated or C-section delivery. Babies who are born at risk are placed in special nurseries, which we'll learn about more in our next lesson. These babies are often kept beyond the normal hospital stay for mothers. Parents visit their babies in these special nurseries. During the hospital stay, medical care is given to ensure the health and safety of both mother and baby. The mother is closely watched to ensure her body is recovering from the exhausting delivery. The baby must be monitored for health conditions and adjustment to life outside the mother's body. Most hospitals have nurseries for a healthy baby's care. Nurses are on duty in the nursery at all times. Except for times when the mother is breastfeeding her baby, much of the baby's stay will be in the nursery. Visitors may see the baby through the nursery window during certain times. Young brothers and sisters may or may not be allowed to visit the hospital. Hospitals that have birthing rooms encourage a rooming-in arrangement. If the baby is healthy, he or she is in a bassinet in the room with the mother. The medical care of the baby can be given in the mother's room, and nurses are still available to help the new mother. The father or support person is provided with a bed. A rooming-in arrangement enables the parents to begin bonding, developing a feeling of affection with their baby immediately. Bonding helps parents and their baby. The first hour after birth is the most sensitive bonding time for parents and their babies. The baby will watch, hear, and respond to the body movements, voice, and touch of the mother and father. Bonding continues during the next few weeks as parents become more and more attached to their babies. So some benefits of bonding for babies: increased chance of survival, they gain weight better, they cry less, and they smile and laugh more, they get fewer infections, they might have a higher IQ, and they have better language development. And for parents, there's less incidences of child abuse, they have faster recovery from delivery, they breastfeed babies longer, they have more self-confidence as a parent, and they have less incidence of depression after delivery if they spend more time bonding with their baby. So all of these are reasons why hospitals would encourage a rooming-in arrangement after birth, because of bonding and how beneficial it is for both parents and babies. All right, that's the end of Unit 2. Thanks for listening, guys.